गुड मॉर्निंग दोस्तों, वंस अगेन मैं डॉक्टर प्रमोद शर्मा आप लोगों के बीच नीट पीजी लाइव डेली में। और जैसा कि आपको पता है कि मैं आपको जनरल फार्माकोलॉजी पढ़ा रहा हूं और उसके अंतर्गत फार्माकोकाइनेटिक चैप्टर वी आर डिस्कसिंग एंड आई हैव ऑलरेडी डिस्कस्ड एब्जॉर्प्शन एंड डिस्ट्रीब्यूशन। तो आज की कड़ी में हमारा अगला टॉपिक होगा मेटाबॉलिज्म। मेटाबॉलिज्म थोड़ा सा बड़ा चैप्टर है, बड़ा टॉपिक है, इसलिए मैं इसे दो भाग में आपके सामने प्रस्तुत करूंगा। इसके दो पार्ट होंगे। तो आज हम पहला पार्ट देखते हैं कि क्या हम सीखते हैं इस मेटाबॉलिज्म के फर्स्ट पार्ट में। तो विदाउट वेस्टिंग आवर टाइम लेट अस मूव टू द डेलिब्रेशन। As you already know that pharmacokinetics is ADME, absorption, distribution, metabolism and excretion. So till now we have covered A and D, and today is the turn of metabolism, that is M. Metabolism is also known as biotransformation. Why biotransformation? Because it transforms a molecule or compound in the body. So that is why it is called in a biological system, transformation in a biological system. So metabolism means biochemical mechanism that converts non-polar compound. Non-polar means जो water soluble नहीं है. It means lipid soluble compounds into polar. Polar, those which are water soluble, with the help of enzyme. Why? Because converting non-polar to polar will make it easy for the compound to get dissolved in water phase so that it can be excreted through urine or through fecal route. So there are certain enzymes which are involved in this metabolism, and these enzymes can be located within the cell or outside the cell, that we will discuss in further slides. And the liver, as we all know, that is the most important organ which actually involved in metabolism of drugs, and other organs may be kidney, intestine के बारे में हमने बताया था, फर्स्ट पास मेटाबॉलिज्म जो इंटेस्टिनल वॉल में होता है, लंग्स, स्किन एंड प्लाज्मा एटसेट्रा, इन सब स्थानों पे आपका ड्रग मेटाबॉलिज्म हो सकता है, बट बाय फार द मोस्ट इम्पॉर्टेंट इज लीवर। व्हाई दिस मेटाबॉलिज्म इज रिक्वायर्ड? क्या फेट है इस मेटाबॉलिज्म का? व्हाट आर द आउटकम्स ऑफ दिस मेटाबॉलिज्म? मेटाबॉलिज्म एक्चुअली डज लॉट मैनी थिंग्स टू a drug. The most important one is it leads to inactivation. The most drugs and their active metabolites are rendered inactive or less active. This is the most common function of the metabolism. Most important. Other thing that can be done by metabolism is the active metabolite which is formed from an active drug is partially converted to one or more active metabolite. An active drug can always give rise to an active metabolite also. It's not necessary that parent active drug is always responsible for all its action. It may be metabolized to an active metabolite that actually take up or does lot of work along with the parent drug. For example, morphine and diazepam. तो morphine 6-glucuronide करके एक मेटाबोलाइट होता है which is highly active. Diazepam is broken down into many active metabolites like desmethyldiazepam, जिसको नॉरडाइजेपैम भी बोलते हैं, इसके अलावा टिमाजेपैम, ऑक्साजेपैम। सो एक एक्टिव ड्रग है जिसका एक एक्टिव मेटाबोलाइट भी फॉर्म हो सकता है। तीसरा काम मेटाबॉलिज्म का है कि एक्टिवेशन ऑफ एन इनएक्टिव ड्रग। ड्रग एज सच इनएक्टिव है लेकिन उसको एक्टिवेट करना है। वैसी ड्रग्स को हम प्रो ड्रग्स कहते हैं। प्रो ड्रग्स इसलिए कहते हैं क्योंकि उनको इसलिए बनाना पड़ता है कि हो सकता है कि उनका एब्जॉर्प्शन किसी तरह से अफेक्ट हो रहा है, इंटेस्टाइन में डैमेज हो जा रही है, लीवर में डैमेज हो जा रही है, एंड दिस इज नॉट बायो अवेलेबल बट मॉलिक्यूल इज प्रॉमिसिंग, इट हैज़ गुड एक्टिविटी, सो वी डूइंग सम केमिकल ऑल्टरेशन इन स्ट्रक्चर we make pro drugs, and these pro drugs once reach to circulation, they are acted upon by certain enzymes and or in the liver or in the circulation, and they are converted into active moiety or active drug. For example, enalapril is converted into enalaprilate, which is an active moiety, and proguanil, which is an antimalarial drug, can be converted into cycloguanil. Likewise, we have acyclovir, which is an antiviral drug used in herpes infection, is converted into acyclovir triphosphate. So prodrugs are actually subjected to activation, because if they are not activated, they will not be functional, they will not be active. So metabolism plays an important role for activating such drug. Not only that, metabolism can lead to formation of more toxic compound. There are certain drugs which are, if metabolized, forms toxic toxic products, like as we know this methanol poisoning, जो नकली शराब पीने के बाद अंधापन और मौत हो जाती है लोगों की, तो ये methanol is converted into formic acid by enzymes which are involved in ethanol or methanol metabolism, जैसे aldehyde dehydrogenase, alcohol dehydrogenase. ये फॉर्मिक एसिड ही है जो जानलेवा होता है, क्योंकि ये मेटाबॉलिक एसिडोसिस करता है एंड और टॉक्सिसिटी इसकी होती है. एंड एसिटामिनोफेन इज़ नथिंग बट पैरासीटामोल. ये अलग अलग नाम है, इसको एसिटामिनोफेन नाम से भी जाना जाता है, पैरासीटामोल नाम से भी जाना जाता है. तो पैरासीटामोल कन्वर्ट होता है एक टॉक्सिक कंपाउंड में जिसको बोलते हैं एन एसिटाइल पी बेंजोक्विनोइमीन. एन एसिटाइल पी बेंजोक्विनोइमीन. तो ये एक टॉक्सिक मेटाबोलाइट है एसिटामिनोफेन का, जो हेपेटिक टॉक्सिसिटी प्रोड्यूस कर सकता है. तो हमने देखा कि मेटाबॉलिज्म कैन, द मोस्ट इम्पॉर्टेंट एक्शन ऑफ मेटाबॉलिज्म इज, और फंक्शन ऑफ मेटाबॉलिज्म इज इनएक्टिवेशन ऑफ द ऑलरेडी प्रेजेंट ड्रग, एक्टिव ड्रग, एंड ऑल्सो टू फॉर्म एक्टिव मेटाबोलाइट फ्रॉम एन एक्टिव ड्रग, और activate an inactive drug, or can lead to formation of more toxic compound which are detrimental to the tissues or body. As far as the location of these metabolic enzymes are concerned, they may be present within the cell or outside the cell. So within the cells, they are usually located either in microsome or in non-microsomal zone. Microsome means they are present in the endoplasmic reticulum. Non-microsomal enzymes are present in the either in the cytoplasm or in the mitochondria. So the cellular enzyme could be both microsomal and non-microsomal. Microsomal enzymes are most importantly carry out most of the oxidation reactions and one conjugation reaction, that is glucuronide conjugation. And non-microsomal enzymes, other than this glucuronide conjugation, all conjugation reactions are carried out by non-microsomal enzyme and some of the oxidation reactions. So this is the difference between microsomal enzyme and non-microsomal enzymes. Other than the oxidation reaction, there is reduction reaction and hydrolytic reactions, and these two reactions can be carried out by both microsomal as well as non-microsomal enzyme. So the location as far as is concerned, as I said, the enzymes are either cellular or extracellular enzyme. So extracellular enzymes are always non-microsomal because they are not present within the cells, and they are present as esterases in the plasma. You must have heard the name of pseudocholinesterase, which actually damages acetylcholine, which if it is given by from outside, or hydrolysis in the intestinal fluid. So हमें ये पता चला कि बायो ट्रांसफॉर्मेशन है क्या चीज़, इसका पर्पस मेन क्या होता है कि नॉन वाटर सॉल्युबल कंपाउंड को वाटर सॉल्युबल बनाना, ताकि ये कैन बी एलिमिनेटेड फ्रॉम द बॉडी थ्रू वेरियस चैनल्स, मे बी यूरिनरी चैनल्स और फीकल रूट. एंड मेटाबॉलिज्म का मेन रोल क्या होता है कि इनएक्टिवेट करना किसी ड्रग को. दिस इज़ द मोस्ट इम्पॉर्टेंट वर्क. It may also lead to formation of, as I said, from the active drug to an active metabolite, or it may activate an inactive drug. Likewise, so these enzymes which are responsible for such reactions, they can be present in the cell or extracellular location. So by up to this point, I think everything is clear, and different type of reactions are oxidation, reduction, hydrolysis, and conjugation reactions. We will see those also when we move ahead. So This metabolism is in the human body is carried out in different phases. Usually there are two important phases, phase 1 and phase 2. Phase 1 always precedes phase 2. Clear? Phase 1 reactions are actually also called functionalization reaction or non-synthetic reaction. Please remember, functionalization or non-synthetic reaction. That it will be more clear when I talk about phase 2, why it is called non-synthetic reaction. So major changes that occurs during the phase 1 metabolic reaction is that a functional group means you can say that functional groups are of different type. That can be a hydroxyl group, amino group, or sulfhydryl group, carbonyl group, carboxyl group. These are all groups, functional groups, which are either added or just unmasked, means they are opened up, which are there already in the compound. They are made accessible by the process of either oxidation, reduction and hydrolysis. So this is the major role of the phase 1 reaction, and metabolite thus formed after the phase 1 reaction are usually active or inactive. They can be of both type, maybe active metabolite and inactive metabolite. As I said, what is the role of metabolism? Either render a drug into an inactive state or can form an active metabolite from an active drug. So the metabolite may be both active or inactive. So these metabolites can be either excreted as such without any further modification in their structure, or undergo subsequent synthetic reaction. Now this word has come again, synthetic reaction. So I will tell you what is these synthetic reactions are. These are called phase 2 reactions. As I said, in body the metabolism takes place in two different phases. Phase 1 always precedes phase 2. So in phase 2 reactions are also called conjugation reactions or synthetic reaction. Why it is called synthetic? Because they are synthesizing a new molecule or new compound. As it is very evident from its definition, you can very well see that the purpose of phase 2 reaction is to couple a drug or its metabolite to an endogenous hydrophilic substrate. These substrates, endogenous substrates, are within the body and they are water soluble. For example, such substrate could be glutathione, glycine, or acetate moiety and all that. So these hydrophilic moiety actually binds with this drug or its metabolite during the phase 2 reaction and forms a compound which is larger in weight but is water soluble, so that it can be excreted from the body. So this is the actual main purpose of the phase 2 reaction. So conjugation, as I said, because it binds drug or its metabolite to hydrophilic substrate that is present endogenously, so it enhances the water solubility, which is desirable, as it will lead to or enhance the excretion of the drug through urinary route or through fecal pathway. Okay, so phase 2 reaction also has certain characteristics. For example, these phase 2 reactions are mainly meant for making a drug or its metabolite water soluble, more water soluble, so that they are excreted. Not only this, they promote or enhance excretion of the molecules, they also terminate the biological activity. I am using term usually terminate. It doesn't mean that it always terminates, because in some cases rather conjugation reaction may increase the biological activity or may impart activity to a molecule. For example, glucuronide conjugate of morphine, morphine 6 glucuronide, which is active. Sulfate conjugate of minoxidil, this is a drug, antihypertensive drug. Also it is used for alopecia, loss of hairs के लिए. तो इसके सल्फेट कंजुगेट इज ऑल्सो एक्टिव. सो इट इज़ नॉट ऑलवेज माने अप्रोप्रिएट टू से कि फेज 2 रिएक्शन और कॉन्जुगेशन रिएक्शन हमेशा ड्रग की बायोलॉजिकल एक्टिविटी को ख़त्म कर देती हैं. ऐसा नहीं है. मैनी अ टाइम द ड्रग बिकम एक्टिव. फेज 2 रिएक्शंस जो हम अभी कॉन्जुगेशन रिएक्शंस की बात कर रहे थे, अगर आप देखा जाए तो ये ज़्यादा तेज़ी से होती हैं. इनकी स्पीड इज़ यूजुअली और रिलेटिवली फास्टर देन द फेज़ 1 रिएक्शंस. तो फेज़ 2 रिएक्शन की स्पीड तेज़ है और फेज़ 1 रिएक्शंस आर यूजुअली स्लोअर देन फेज़ 2. सो फेज़ 1 रिएक्शन बिकम्स रेट लिमिटिंग. एज आई सेड, द मेटाबॉलिज्म ऑफ ड्रग यूजुअली अकर्स इन फेज वाइज मैनर एंड इट phase 1 always in almost all cases precedes phase 2 reactions. So unless until phase 1 reaction is over, the phase 2 reaction cannot start. So phase 1 reaction becomes rate limiting. So metabolic time for metabolism required for a drug will depend upon the pace of the phase 1 reaction. So phase 1 reactions are considered as rate limiting. And all phase 2 reactions are carried out in cytosol. Why cytosol? As I already said, कि phase 2 conjugation reactions are phase 2 reactions. All conjugation reactions are carried out, or non-microsomal and non-microsomal reaction occurs where either in mitochondria or cytosol, except one conjugation reaction, that is U2P. U2P glucuronosyl transferase enzyme है जो कि UDP glucuronidation कराता है. तो उसको छोड़कर बाकी सभी conjugation reaction साइटोप्लाज्म में होती हैं. ठीक है. बट मैंने जैसे कहा था कि ऑलमोस्ट ऑल रिएक्शन फॉलो अ सीक्वेंस, दैट इज फेज 1 रिएक्शन अकर्स फर्स्ट, फेज 1 मेटाबॉलिज्म फॉलोड बाय फेज 2 मेटाबॉलिज्म. बट देर आर सर्टेन एक्सेप्शंस. एज आई सेड, नथिंग इज ऑल और नन. देर आर एक्सेप्शंस. फॉर एग्जाम्पल INH, that this is also called isoniazid, which is an anti-tubercular drug used in TB infection. It is first acetylated. This is acetylation is a phase 2 reaction because conjugation is occurring with acetyl moiety. So this is phase 2 reaction occurs first, then it is hydrolyzed to isonicotinic acid, which is active drug. So phase 1, this undergo phase 1 reaction, isonicotinic acid. So here the sequence is reversed. So there are always some exceptions in everywhere in nature. So this is nothing, something which should not puzzle you, I think, and in fact you should remember this. It could be an important question in entrance examination you face. Here I am showing you some examples of conjugation reactions. What are the moiety which can take part in the conjugation reactions, which makes them either the parent drug or its metabolite more water soluble. So most important is glucuronidation, which is carried out by an enzyme. This I will discuss what are the enzymes which carry out these reactions. So glucuronidase is very important in morphine. As I said, morphine 6 glucuronide was found which is active, which is an exception. Otherwise usually conjugation reactions leads to loss of activity of the drug. Acetylation. Here there is conjugation with acetyl moiety, and this is more important or important in case of sulfur drugs, and isoniazid. Glutathione conjugation in case of acetaminophen or paracetamol. Glycine conjugation, salicylic acid, that is used in making aspirin, that is acetyl salicylic acid. So glycine conjugation is important in case of salicylic acid. I am giving one or two example because there will be an exhaustive list of drugs which are actually subjected to such reactions. And sulfation, where sulfate moiety is attached, example is methyl dopa. Methylation in case of histamine, dopamine or epinephrine is amines. So methylation is an important conjugation reaction in case of these amines. And water conjugation. Conjugation is also a conjugation reaction, and this occurs in case of carbamazepine epoxide. Epoxides are usually toxic chemicals. So carbamazepine epoxide or LTA4, you must be knowing this mediator formed during cyclooxygenase pathway and lipoxygenase pathway, that is leukotriene A4. So they carbamazepine epoxide and LTA4 undergo water conjugation. So these are few examples of your conjugation reactions. So you please remember one or two examples of each, and you must be knowing all such reactions, so that it will be easier for you, or easier for you means such question may always be asked from these reactions or substrate for such reactions. So be little aware of these facts. Keep things in your mind so that you can answer when the need arises. हमने कॉन्जुगेशन रिएक्शन की बात किया. फेज 1 रिएक्शन में हमने कहा था कि ऑक्सीडेशन हो सकता है, रिडक्शन हो सकता है, हाइड्रोलिसिस हो सकती है. तो अब हम बात करेंगे कि ऑक्सीडेशन रिएक्शन का मतलब क्या होता है, कहाँ हम कौन से एंजाइम ऑक्सीडेशन रिएक्शन कराते हैं, किस किस रिएक्शंस को ऑक्सीडेशन रिएक्शन कहते हैं. अब हम उसके बारे में बात करेंगे. ऑक्सीडेशन इज़ द मोस्ट इम्पॉर्टेंट ड्रग मेटाबोलाइजिंग रिएक्शन. देयर इज़ नो डाउट अबाउट इट. Most of the drug undergo oxidation reaction, undergo oxidation, and oxidation is defined as incorporation of oxygen or a negatively charged radical, or reverse, for example removal of hydrogen or addition of a positively charged radical to a drug. This is called oxidation. As I said, this is the most important metabolizing reaction. And enzymes responsible for these oxidation reactions are mainly cytochrome P450 enzyme. You must have heard this name earlier also during your UG course when you read pharmacology in second prof. So this CYP's enzymes are very important in carrying out oxidation reaction. Other than that, we have FMO. FMOs are flavin monooxygenases and epoxide hydrolase. This epoxide hydrolase is very important and plays a very important role in certain reactions. So these are the enzymes most commonly involved in oxidation reaction. So oxidation, as I said, is the most important reaction, and it can occur, as we already discussed, that oxidation reaction occurs within the cell, and some are microsomal. In fact, most of them are microsomal and some are non-microsomal. So microsomal, we have different reactions. Oxidation, these are all type of oxidation reaction which I am naming, like hydroxylation. This could be aliphatic hydroxylation or aromatic hydroxylation, dealkylation. This is also called N-dealkylation, O-dealkylation, S-dealkylation. Likewise, N and S deoxidation, oxidative deamination, epoxidation, desulfuration. So we should not go into much detail of this, what hydroxylation is, what dealkylation is. We should know that these reactions fall under the category of umbrella category of oxidation. These are all oxidation reaction which occur in microsomes. That is more important. That a question may be asked, hydroxylation is a type of reaction, type of oxidation reaction occurring in microsome, non-microsome, or extracellular, or something like that. It can be asked. So it is important from that point of view that we should have little idea about that these terms or these reactions fall under the category of oxidation. Oxidation occurs not only in microsomes, they occur in non-microsomes also. So they could be non-microsomal, and when they are non-microsomal, then there are other group of enzymes which are involved in oxidation reactions. You can see xanthin oxidase, a very known enzyme. Everybody must be aware of this enzyme. If you remember, yeah, you are thinking right, this you came across this enzyme in chapter of gout. This xanthin oxidase is enzyme which converts hypoxanthin to xanthin, and xanthin is further converted into uric acid by xanthin oxidase. So this enzyme, you must know, alcohol and aldehyde dehydrogenases, very important drugs when we study or read the chapter of ethanol. So these enzymes come into picture. Monoamine oxidase, very important, and very commonly when we go through autonomic nervous system, you will see this enzyme there. So these enzymes are important for oxidative deamination. This oxidative deamination can occur microsomal also and non-microsomal also. So this oxidative deamination of catecholamines occurs by monoamine oxidase, and catecholamines are adrenaline, noradrenaline, dopamine. These are catecholamine. And decarboxylation of levodopa. Dopa decarboxylase enzyme is present in the intestinal wall, and this leads to levodopa is a drug which you read in the chapter of Parkinsonism. So the decarboxylation is important. So it inactivates levodopa by decarboxylation of levodopa leads to inactivation of this moiety. That is why we use decarboxylase inhibitor when we use levodopa in the therapy of Parkinsonism. So these are non-microsomal enzymes which are involved in oxidation reaction. And now we move ahead and see other type of reactions. That is, another major reaction is the reduction. The reduction is also defined as either addition of hydrogen moiety or removal of oxygen from a compound. So that is defined as a reduction. And reduction and hydrolysis, I said earlier that both microsomal and non-microsomal enzyme can lead to reduction or hydrolytic reactions. And different type of reduction we usually see in our human body, that is azo reduction, nitro reduction, or carbonyl reduction. Azo reduction is responsible for reduction of prontosil. This was a old sulfonamide kind of drug which was an antibacterial agent long back. And nitro reduction is important in case of metabolism of chloramphenicol. And this nitro moiety, when it is present in the intestine through bile, it is acted upon by certain bacteria, intestinal bacteria, and which forms a toxic intermediate. And that toxic intermediate is supposed to be responsible for aplastic anemia commonly, or is a very dreadful complication or adverse effect of the chloramphenicol therapy. So this is actually a hypothesis that this could be a reason. And other than that, important reduction reaction is carbonyl reduction. That is, we see for the drug like methadone, which is a drug from opioid group, opioid compound, and naloxone. Naloxone is opioid antagonist. So carbonyl reduction is important for metabolism of such compound. Another group of reaction is hydrolysis. And hydrolysis is, if you can say, is the simplest form of reaction, and it is due to the cleavage of drug by taking a molecule of water. So it is the reaction of the compound with the water, and usually esters, amides, and polypeptides are metabolized by these hydrolytic reactions. And one important enzyme, that is epoxide hydrolase, which is very important in detoxifying various epoxide metabolites. These epoxide metabolites are actually highly reactive intermediates, and they are formed by the action of the cytochrome P450 enzymes acting on different drugs. So this epoxide metabolites needs to be detoxified, and in that epoxide hydrolase play an important role. So it has activity against those epoxide metabolite. Such hydrolytic enzymes are present everywhere, like in liver, intestine, plasma, other tissues like kidney, and the drugs which are usually undergo hydrolysis are choline esters. Choline esters के बारे में आपने पढ़ा होगा, तो इसमें choline esters में आपने पढ़ा था methacholine, carbachol, bethanycol. इसके अलावा lidocaine, it is an amide linked local anesthetic. Procainamide का आपने नाम सुना होगा एंटी एरिथमिक ड्रग में. एस्पिरिन, वेरी वेल, you all are very well aware of this aspirin. Carbamazepine, an anti-epileptic drug. Pethidine, which is an opioid compound. And oxytocin. Oxytocin is a peptide drug which is a hormone released by posterior pituitary. This oxytocin has role in obstetrics, and this oxytocin is actually metabolized by an enzyme oxytocinase, which is an aminopeptidase, which is present in the liver and kidney both. So this oxytocin is a polypeptide group of drug. So esters, amides and polypeptides are usually the substrate for hydrolytic reactions. We talked about cytochrome enzymes, that they are involved in oxidation reaction, and oxidation reaction is the most important drug metabolic reaction in phase 1. So, and majority of the oxidation reactions are carried out by cytochrome P450 enzyme. So we should know a little bit about cytochrome P450 enzymes. It's how they are important, what is their nomenclature, how they are it means their nomenclature, how they are assigned in different families or subfamilies, and what are the cytochrome enzymes which are important for humans. And likewise I will be discussing such each points one by one. So these enzymes, cytochrome P450 enzymes, are also called mixed function oxidase or monooxygenase. So they are also known as MFOs. And FMO, which I said earlier, is different, that is flavin containing monooxygenases, right? So cytochrome enzymes are so important for humans that almost about 2/3 of the clinically available drugs are metabolized by the cytochrome P450 enzymes. So very important enzyme group of enzymes, and we must know. And whenever you talk about metabolism of any drug, you will always see that some or other cytochrome enzyme is involved in its metabolism, as more than 2/3 of the drugs are metabolized by them. These enzymes are actually all heme containing enzymes, heme containing proteins. And you must be knowing, when you studied about anemia, iron deficiency anemia and all that, even if iron content deficiency is very severe, despite that the iron deficiency does not affect the activity of these enzymes. Their activity remains intact. So please keep this in mind. So these enzymes are all heme containing enzyme because heme contains iron, so they are iron containing enzyme. And for reaction to be carried out by these cytochrome P450 enzymes, there is always a need of reducing agent. For example, in every case they in such reaction reduce NADPH is used as a reducing agent, and molecular O2, and the end result of such reaction is usually formation of an oxidized substrate which accept one atom of the oxygen, and a molecule of water which accept another atom of the oxygen. So both the things are important, that molecular O2s must be present and a reducing agent in the form of NADPH must be present. And during this process, actually there is generation of oxygen free radical. You know, these free radicals are important in the sense that they produce oxidative stress and may lead to damage to the tissues. That is why such quenching of such oxygen radicals is necessary, and thus is carried out effectively by many enzymes that our body has, which has protective role. And this O2, this is actually superoxide free radical, is usually converted to water by the enzyme superoxide dismutase. That is why if it is a superoxide free radical, it is acted upon by the superoxide dismutase. And this SOD, superoxide dismutase, is a very important defense present in the human body against the oxidative stress. So people deficient in superoxide dismutase have lot many problems and can lead to enhanced oxidative stress. Now we come to the nomenclature of CYP, how these cytochrome P450 enzymes are actually assigned different families, subfamily, or their isoforms. So depending upon the extent of amino acid sequence homology, we actually see how much similarity is there in the amino acid sequence between the different families. So families usually have amino acid sequence homology of 40%. 40% amino acid sequence is, if matching, they are classified into families, same families. And depending upon that, 40% there is similarity among all families. Amino acid sequence is similar. 40% amino acid sequence is similar in all families. So families are actually usually designated as by a numeral like 1, 2 or 3, and likewise subfamilies are categorized or designated capital letter A, B, C, not numeral. They are subfamilies are indicated by capital letter, and these subfamilies have 55% amino acid sequence homology. As in case of families, there was only 40%. Very surprising that some subfamilies have more similarity among themselves. So they are designated by capital letters like A, B and C. And individual isoform of the enzymes are allotted numbers, again as in numeral 1, 2, 3, 4 like that. तो हम अगर एक एग्जांपल देखें CYP3A4, मैं क्यों CYP3A4 के बारे में बात कर रहा हूँ कि ये एंजाइम सबसे इम्पॉर्टेंट एंजाइम है अपने इसके लिए साइटोक्रोम एंजाइम्स में, जो सबसे ज़्यादा ड्रग्स का मेटाबॉलिज्म करता है. इसलिए मैं इसको एक एग्जांपल की तरह मैं ले रहा हूँ. तो इसमें 3 इज़ दी फैमिली, इट बिलोंग्स टू फैमिली 3. ए सब फैमिली हो गया और आइसोफॉर्म टाइप 4 हो गया, क्योंकि CYP3A4, CYP3A5 और भी हैं, लेकिन हमें वो देखना है जो हमारे ह्यूमन बॉडी में इम्पॉर्टेंट हैं. हम उसी के बारे में डिस्कस करेंगे. तो CYP3A4, whenever you are asked to say any CYP enzyme, this CYP enzyme isoform, specific isoform should always come to your mind first, because this is most important cytochrome P4 enzyme. In human body, if you see the CYP enzymes from family 1 and 2 and 3 are usually important because they carry out most of the metabolism of the drug. Majority of the drugs are metabolized by these 3 families only. So we have important enzymes from these families, as I said, CYP3A4, 2D6, 2C9, 2C19, 1A2, 2E1. These are important. You will come across these enzymes when you read pharmacology, the metabolism of each and every drug. You will find one or other enzyme involved in their metabolism. So these are the common enzymes which are involved in metabolism in human. But CYP3A4, as I said, is the most abundant of all these enzymes, because this is the most important enzyme and it accounts for 30% of the total liver CYPs. You can imagine, out of many enzymes, this alone constitutes around 30% of the total CYP molecules present in the liver. And these cytochrome enzymes not only involved in the metabolism of exogenously administered drug, but they can also be involved in synthesizing endogenous substances like steroid. We know that within the body we have several steroid hormones, bile acids. So these are all synthesized by cytochrome enzymes in the body. The cytochrome P enzymes are unique in the term that they are not specific in their activity. Non-specific, you can say that one drug can be metabolized by several cytochrome enzymes, and one drug can be metabolized by several cytochrome enzyme, and several drug can be metabolized by one enzyme. So this non-specificity is always there in their activity. So there is no clear cut that one particular drug will be metabolized by one particular drug. It is not there. There can be several enzymes involved in its metabolism. So they may show non-specificity in their activity, and other than that may show high genetic variability. Not all, but some group of enzymes are very notorious for showing genetic variability, and their various phenotypic variants have been identified, and most notorious in this for genetic variability is the CYP2D6, though we have CYP2C19 also, that also show genetic variability, and they have bearing on the metabolism of drugs in different individuals, because different individuals demonstrate different level of activity of such enzymes. So that is necessary to know before treating a patient. That is why a concept of individualization of therapy is coming nowadays, and that is will further, I think, make therapy or therapeutics more rational. So the CYP enzymes are present in everywhere where they are required, like in liver for drug metabolism, and as I said, they are involved in synthesis of endogenous substance like bile and all. Intestine, you saw in intestine they were involved in first pass metabolism, that is by thereby decreasing bioavailability. Adrenal, testis, ovary, all these three are sites for the synthesis of steroid hormones. So they must be present there to make such hormones, this steroids hormone. So they are present in liver and such organs. Another enzyme which is responsible for oxidation reaction in phase 1 is flavin containing monooxygenases, and popularly known as FMO. They are highly expressed in liver, and they are also bound to endoplasmic reticulum. And it has 6 families, and out of those 6 families, the third family, that is FMO3, being the most abundant in humans, and they metabolize many drugs like nicotine, ranitidine, clozapine, which is a drug for an antipsychotic drug, atypical antipsychotic drugs, and the itopride. So the importance of such enzymes, though they are minor contributor in drug metabolism, they do not play a major role. But the advantage of with such enzymes are that they are neither induced or not inhibited. So I will talk about what is this induction or inhibition. So that way you will come to know why such a property is important or is beneficial for us in therapeutics. So if they are not induced, they are not inducible or are not subject to inhibition by other drugs, so they are not expected to be involved in drug-drug interaction. We know many a times to treat a patient we need to give many drugs together, maybe 3, 4, 5 drugs. So there is always high likelihood that one drug may interact with other at the level of metabolism. There comes the importance of this induction and inhibition, and how this process of induction or inhibition affects the overall drug metabolism and may result in either toxicity or therapeutic failure. The hydrolytic enzymes is another group of enzymes which are important for hydrolytic reaction, and we discussed that epoxide hydrolases and other esterases and all, where those enzymes that led to that were responsible for the hydrolysis of drug compound. And this epoxide hydrolase especially carry out hydrolysis of epoxides, which I said are very toxic intermediates formed by the action of CYP on different chemicals. And these epoxides are, as I said, are highly reactive, can bind with RNA, DNA or cell structures, and can cause toxicity and transformation of cells. So these needs to be detoxified, such epoxide, and in that epoxide hydrolase plays a major role. Carboxyl esterases catalyzes the hydrolysis of drugs which are chemicals which contain amide or ester groups, and these hydrolytic enzymes are found both in endoplasmic reticulum as well as in the cytoplasm. As we earlier discussed, that hydrolytic enzyme or enzyme responsible for reduction are present both in, but could be both microsomal or non-microsomal. So this enzyme, as I said, involved in detoxification. Detoxification is important in case this carbamazepine, you must be knowing that this is an important anti-epileptic drug, which is actually by action of CYPs converted into its inactive metabolite, that is 10-11 carbamazepine 10-11 epoxide. And this epoxide is further hydrolyzed by, because that epoxide is toxic, hydrolyzed by epoxide hydrolase And epoxide hydrolyze actually exists in two forms, that is one in soluble form SEH and one in the microsomes. So it is detoxified by microsomal epoxide hydrolase, and that is further actually conjugated and excreted by the kidney. And these hydrolytic enzymes may also be important for metabolic activation of certain drugs. For example, we have a drug called irinotecan, that is a camptothecin analog used in cancer chemotherapy, and which is considered as a pro drug, and it by action of this carboxyl esterases. This is intracellular carboxyl esterase I am talking about. Otherwise there are esterases which are extracellular also. I discussed earlier that when I was talking about the location of the enzyme, the cellular enzyme, the extracellular enzyme, then extracellular enzyme, we knew about esterases, hydrolases. So this carboxyl esterase which is involved in the metabolic activation of irinotecan is intracellular carboxyl esterase, and that converts this irinotecan to an active metabolite that is called SN38, which has anti-cancer activity. So this is all about hydrolytic enzymes. So we talked about hydrolytic enzyme, reductive enzyme, and oxidative enzymes. And among the oxidative enzymes, important ones were the FMOs and cytochrome P450 enzymes. So till this point we have learnt a lot about these enzymes, reactions, and substrate and all that. Now we come to conjugation enzyme, which is important phase 2 reactions, or in fact phase 2 reactions are mainly conjugation in reactions, and there are certain enzymes involved in their involved in conjugation. We have already talked about different conjugation reaction, that sulfation, acetylation, methylation, sulfation, and glucuronidation and all that. So the important enzymes, conjugation enzymes are GST, this is glutathione S transferase, UGT, this is UDP glucuronyl transferase, sulfotransferases, N-acetyl transferase, and methyl transferases. So when we are talking about all this, as I said earlier also, that all conjugation reaction occurs in the cytosol, that is in non-microsomal area, but except UGT, that is UDP glucuronide transferase reaction, glucuronide conjugation, which is popularly known as. Except this reaction, all are non-microsomal reactions, or enzymes are non-microsomal, and only this glucuronidation occurs in the microsomes. And this conjugation reaction usually require O, oxygen, nitrogen, or sulfur atom, so that they can link covalently the drug to a hydrophilic endogenous compound, as I said, glutathione or glucuronic acid, so that they becomes water soluble and are excreted from the body. So this importance of these atoms O and S is must for a conjugation reaction to take place. And this glucuronide metabolite, the purpose of the conjugation reaction is to make lipid soluble drug less lipid soluble or water soluble, so that they can be excreted in the kidney. But this glucuronide metabolite is more water soluble with a higher molecular weight, because this endogenous substance is attached to the drug, so its molecular weight increases, but it is excreted in the urine and bile as like other sulfate conjugate or acetylated conjugate, like that. This conjugation reactions, as I said earlier also, the purpose is in most of the, practically almost all cases, they attenuate the activity of the drug, but there are certain exceptions. As I said, morphine and minoxidil, their conjugates may be active. So conjugation reaction usually attenuate activity, because after binding with this hydrophilic endogenous substance, their structure or original forms is changed, so it is not able to interact with its receptor target or any other target. So the reaction gets over and it becomes inactive. So conjugation reactions are important in attenuating the activity of the drug. Microsomal enzyme induction. I was talking about induction, inhibition. So today we'll talk about induction. Maybe in the second class we'll talk about inhibition. So these microsomal enzymes are inducible. Induction doesn't mean that the activity of enzyme is increased. No, activity of the enzymes remains same, but the number of enzyme molecule increase. Clear? So what happens, there is increased messenger RNA for enzyme which is getting induced, increased protein enzyme molecule is there, and there is increase in the weight of the liver. These are all signs of induction of the enzyme. And important drugs which we always quote as an enzyme inducer is phenobarbital, rifampicin. They induce CYP3A isoenzyme. This is important. Why? Because this CYP3 enzyme is involved in most of the metabolic reaction, CYP3A4 especially, and likewise isoniazid and chronic alcoholic has induced CYP2E1. Polycyclic hydrocarbons, they are also better known as polycyclic aromatic hydrocarbons. They induce CYP1A. These hydrocarbons are usually present in smoke, cigarette smoke, and charcoal, broiled meat and all that. So smokers usually have induced activity of certain cytochrome enzymes. This involves enzyme in liver and other organs. Not only enzymes present in the liver are inducible, but they are also inducible wherever they are present, like ovaries, adrenal, testis, and intestinal wall, all that. So if any enzyme is induced, it can have effect on the bioavailability of the drug also. So induction can increase the metabolism of a drug by 2 to 4 fold. So you can understand that if it is more efficiently metabolized or metabolized much faster, then what will happen? The concentration achieved in the plasma may remain subtherapeutic, and there may be a therapeutic failure. Induction, as there is synthesis of new protein, new enzyme molecules, it will definitely take time, and that is why it is a gradual process, and it takes time to reach its peak. But once it is the drug which is inducing the enzyme is withdrawn, it will take some time for activity of this enzyme to come back to normal, because already there is increased enzyme molecule number of enzyme molecules that they will gradually, they have their lifespan, and this activity will also reduce gradually over a period of time. What are the consequences of enzyme induction? Okay, we knew about induction, that how this induction takes place and what is the mechanism behind it, but what could be the role of this enzyme induction, or what consequences one might face subsequent to enzyme induction? So as I said, that the metabolism increases by 2 to 4 fold, so the plasma concentration may not be achieved, and the drug will be removed faster. So the lower the plasma concentration, the intensity of the action may decrease, or the faster elimination may decrease the duration of action of the drug, and such may lead to, and many a time, failure of the therapy. For example, oral contraceptive pills failure. Women is taking OCP for protection against pregnancy, but actually it led to the patient, and suppose that woman is suffering from epilepsy also, and taking an epileptic drug which actually inducing the drug enzyme which actually metabolizes oral contraceptive pills, so that will lead to failure of protection against pregnancy. But not always there is a decreased intensity. Increased intensity of action may also be observed when a drug is activated by metabolism. For example, many prodrugs, or like this paracetamol is metabolized, and is a minor part of it is converted into a toxic metabolite, which I said N-acetyl P benzoquinone. So if this intensity is increased more and more, that metabolite will be produced, and that can lead to hepatic toxicity. That usually happens if you take overdose of paracetamol, or there is extreme enzyme induction of that. Beta blockers, if a patient is taking phenobarbital and at the same time concurrently using beta blockers, so if suddenly phenobarbital is stopped, because that is an enzyme inducer, what will happen? This beta blockers action of intensity will increase, or may even frank toxicity may be produced. It might lead to, the induction might lead to tolerance. Tolerance is nothing but, tolerance is defined as to achieve the original response, you need to increase the dose of the drug, because gradually tissue become less responsive to the same dose of the drug. So many drugs induces its own metabolism, that is called auto induction, and carbamazepine is very notorious for this. You can very well imagine that how this induction can increase the requirement of the dosage modification. we usually start therapy with carbamazepine at 400 milligram, and at peak of its auto induction, one person may require even 1800 milligram per day. Endogenous substrate are also metabolized faster, so there may be a deficiency state may be set in, because when steroid hormones are, if they are metabolized faster, they can lead to a type of deficiency state. So this is also a consequence of enzyme induction. Acute intermittent porphyria, that can be precipitated. This is a metabolic disorder, heme metabolic disorder, and many of the drugs have been found to precipitate acute attack of intermittent porphyria, and because this is presumed to be due to increased activity of delta amino levulinic acid synthase, and that is the result of the induction of that enzyme. These induction may also interfere with the adjustment of the doses of the drug, because if patient is on chronic therapy for suppose hypertension or for diabetes, or if a patient is epilepsy, a patient is taking anti-epileptic drug therapy, or patient is on anticoagulant therapy, then it will be difficult if a patient is concurrently taking a drug which has inducing property and induces the enzyme which are involved in the metabolism of such drugs which are used in chronic therapy of many ailments. So it will be difficult to adjust the doses of the drug. You have to need to pay more attention, more frequently see the need for change in the dosage of these drugs. So that adjustment becomes challenging in such cases. Prodrugs are, as I said, they are inactive as such, but when they are metabolized, a certain groups are removed from them, chemical group, they becomes active. If a prodrug which is fully activated within the portal circulation or through the passage through the wall of the intestinal wall, or through the liver, first pass metabolism, first pass movement through the liver, then there is no problem. There is no problem with induction. It will not affect. But those prodrugs which circulate and slowly gets converted into active drug, then it will be little complicated. Why? Because if it is converted in active form slowly, what will happen? It will converted very fast in active form. So that will lead to increase in concentration of the active drug. That will lead to high intensity of action, or sometimes may produce toxicity. But at the same time, it will be metabolized faster also. So you need to give more frequent dosing. So the end result would be for those products which circulate and gets converted into active moiety slowly, then you have to give a low dosage but more frequent dosing to compensate for this effect of induction on such drug. Interference with chronic toxicity testing in animal. Whenever a drug is developed for human use, they are tested for acute toxicity, subacute toxicity, chronic toxicity testing in animals like mice and rats. So if a drug has induction property, that drug might induce its own metabolism. So what will happen? The plasma concentration of the drug will fall to a very low level. And if we are not aware of this fact, what will happen? That the drug will not be effective, and we cannot find out whether this drug caused toxicity on chronic use or not. So we should be aware of this fact so that dosage adjustment accordingly can be made throughout the period of testing of the toxicity. These are the usual drugs which are very notorious for drug interaction, like phenytoin, warfarin, theophylline, OCPs, and imipramine, which is an antidepressant, tricyclic antidepressant drug. How induction can be exploited? Everything is not bad. Please remember that. Every individual have good properties and bad qualities. So it is not always that everything which we see is bad. So induction can be exploited for therapeutic purpose also. For example, congenital non-hemolytic jaundice. It is usually that because of the deficient glucuronidation of bilirubin, because metabolic child do not have everything functionality of all organ equivalent to an adult. They gradually, these function gradually matures over a period of time. So because of the deficient glucuronidation of bilirubin, this bilirubin can penetrate in the blood-brain barrier, because that blood-brain barrier is also not well developed in infants or neonates. So that can lead to problems. So we can use an enzyme-inducing drug phenobarbital so that it can lead to induced metabolism of bilirubin, right? So it can increase glucuronidation of bilirubin, and glucuronidation is a macrosomal enzyme, and macrosomal enzymes are the only enzymes which can be induced. So phenobarbital can be used as a therapeutic agent here in this condition. Cushing syndrome is the overactivity of the adrenal gland. So we have symptoms or signs of over secretion of the hormones. So phenytoin may enhance degradation of adrenal steroids, because there are certain cytochrome CYP enzymes which are involved in the metabolism of these steroids. So phenytoin can be used to induce these enzymes, and they can degrade these steroid hormones and can bring down the overactivity of the steroid to a normal, towards the normal. In case of chronic poisoning, where the poison has deposited in the body and remain there for the longer period of time, so it is presumed that giving an drug which can induce certain enzymes that can act upon this poison metabolism, can act on this poison, that can metabolize these poisons, so that can lead to release of these poisons from the accumulated area of accumulation to outside the body. So such can be how this induction can be utilized in case of chronic poisoning, and thereby they cause faster metabolism, and this accumulated poisonous substance may be removed from the body. Liver diseases, in decompensated liver disease or in chronic liver diseases like cirrhosis and all that, there is compromised enzymatic function or metabolic function of the liver, but it has been established many times, but there are anecdotal reports, and it is not very well with conviction. It cannot be said that in liver disease, if you use enzyme inducers, that can increase the enzymatic activity of the drug. However, it has been also claimed that the induction ability means ability of drugs to induce enzyme even in drugs with advanced liver disease, even liver with advanced disease can be achieved. So it is presumed that giving some enzyme induction inducing drugs in patient with end stage liver disease or cirrhosis might improve activity of certain enzymes. So this is still not very convincing, but that is why it is colored it in blue, that with conviction we cannot say that yes, such therapy will definitely help in patient with liver disease. So boys and girls, we have learnt today in first part of this metabolism many things, that what are the microsomal enzyme, non-microsomal enzyme, what are phase 1 reaction, phase 2 reaction, what is induction, how reactions are carried out, what are the drugs and their consequences of this enzyme induction and all that. And now in the second part of metabolism, I will be discussing about enzyme inhibition and their clearance, etc. So till then, wait for second lecture on metabolism. But before leaving, I would suggest that you download this Unacademy learning app and install it on your device, and maybe on the tab or mobile phone, and you can select the course which you are looking for. Like I am educator of NEET PG, you can select NEET PG, and you can find out NEET PG Plus, select NEET PG Plus, where you get exclusive content on the Plus, which is subscription based. Other than you can have free demo classes and other things on these sites also, Unacademy site, where free courses on YouTube, and at Unacademy site, that is special classes, you can always have a look. But for a better understanding and all that, you can get subscription of NEET PG, and that is available by paying a certain amounts, and this is available for 12 months and 24 months. I would request that 24 months is better always, because longer the period, better always it is. But no, don't forget to apply this code, because I am Dr. Pramod Sharma. So apply this code, so you will get 10% instant discount. And once you are happy or satisfied with my way of teaching and the content I am delivering, you can always subscribe to this channel, NEET PG. And don't wait, just do it. If you are really take the advantage to the fullest, and I would ask that just push this bell button so that you are always familiar with, or always get the latest notification about NEET PG. And you like this channel, share it with your friends, relatives as much as possible, and don't forget to subscribe it. And when you are happy and you find classes satisfactory, and you really believe that you are learning from on this platform, so you can use this referral code for Pharmacology, Dr. Pramod, and get 10% instant discount. And I would hope that you will be doing it just after this class. Thank you very much. I wish you all the best.